from St. Louis Public Radio. This is St. Louis on the Air.
And then the vaccines started coming, they were coming, so we had to start educating people in their language, meeting them where they were. That was very important.
We talk about a lot in just in general in like healthcare provision and provision, I think, of just like social services, cultural competency. And that really is just kind of the bare minimum, I would say.
I'm Sarah Fensky. Across the U.S., Latinos have lagged behind their counterparts in COVID-19 vaccinations. But that is not true in Missouri. Here, 56% of the Hispanic or Latino population has received at least one dose of the vaccine. And that's true of just 47% of non-Latinos. One reason for that success may be the work of STL Juntos. The group was formed during the pandemic to help connect people within the Latin community to healthcare and support. And joining us today to share about that work and why the vaccination rate here is higher than you might expect is Lourdes Trevino Bailan. She is a co-founder of STL Juntos. Lourdes, welcome.
Hi, thank you for having me.
And we're also joined today by Julia Lopez. She's an instructor in medicine in the Division of Infectious Diseases at Washington University School of Medicine and a PhD in public health. Julia, welcome.
Yes, buenas tardes.
So Lourdes, I want to start with you. STL Juntos formed right at the start of the pandemic. What made you realize there was a need for this kind of group?
Well, like everybody else was being sent home. And we were watching the news, and all we were seeing was English information and very little of, right? We were going back home, and we're trying to figure out, okay, how are these other people that have a language gap not getting the information?
Just basic stuff about COVID-19. It's here.
Basic, stay at home.
Very basic. So that's obviously a big concern if you're thinking Spanish speakers aren't going to be getting information that makes sense to them. How did you go about trying to put together a group to address this?
Yes, so my friend and co-founder, Gabriela Ramirez Arellano, we were on the phone. She calls me. We're like going back and forth. Who's getting the information? Who's giving it out? Everybody's home. Everybody that has funding to do this type of stuff is now home without funds and not figuring out what to do. So we decided to translate the first stay-at-home order. And when we translated that stay-at-home order, the hits that we got through Facebook, obviously, that's all the reach we had. We had to reach the community somehow. And the amount of people we've reached was just so overwhelming that we just thought, we need to continue, sharing information, whatever is coming out.
So Lourdes, this is great that you put this out there and there was such a need, but this previously hadn't even been translated?
Nothing was translated. I mean, even the English information was coming out, and nobody knew what.
It was kind of hard to follow what was happening.
Very
where.
hard.
Yeah.
So we just decided let's go ahead and translate this information. Yes.
Yeah. So that's a great start, and that's a good thing you did. Then you brought in some health professionals to help deal with some additional things. How did you begin reaching out to the kind of people who would be willing to help with this effort?
So our only thing that we wanted to do was just translate the information right as it was coming out, but. To our surprise, we got a call and we were reached out from the medical staff and students from Washington University. They reached out to us and they were looking for a platform to share information and do outreach for the Spanish speakers. So that's when we connected, and they were a big part of our initial state. So we started doing PSAs, just information myths. Just a whole bunch of information that was actually accurate information. And verified.
So, Julia, I imagine this is where you come in. Washington University understood that there was a need here. Is that right?
Yeah, absolutely. I think it was during that time that I got to meet with Lourdes and really be able to kind of provide really this kind of myth-busting space and collaborate with other colleagues, both in the Division of Infectious Diseases as well as others who were interested in that support, students and medical students and others who wanted to come together in this unified front to really kind of provide as much information in the Spanish-speaking language as possible. And so From my perspective, it was very much from a public health, epidemiological standpoint, but also at the intersection of mental wellness, mental health, substance use, as I'm also a licensed clinical social worker. So I really practice quite a lot in that space in relation to infectious diseases and the impact that has on people's well-being. And so that was something that was particularly, of course, becoming very much front and center into, people's day-to-day living.
Yeah, I feel like so many of us at the beginning of the pandemic, our minds were just racing. So many of us turned to perhaps self-medication in ways that was not healthy. Lourdes, sounds like this was something where the community really responded well to this as well.
Yes. So our initial state was just translate. And then we realized these people needed mental health or health information, right? They wanted to talk to somebody. They wanted to, know that what they were feeling was also something that everybody else was feeling. It was normal. And that's where Julia came in. Dr. Julia came in, and we did, I think it was once a month that we were doing an outreach for the community to just come together and talk.
And so, Julia, how do you do that, though, at a time when we were all supposed to not come together? Was this something that you had to do virtually?
Yeah, we decided to come. When we were all talking, like Gabriela, Lourdes, and I, we were saying, okay, we're gonna do these like charlas. So like this very, trying to keep it very like casual, Zoom, like come bring your cafe, like bring your coffee, and like come to these Zoom hangouts on Monday mornings. And for a little while we were doing it. We started off slow, but then realized that people were really like engaging, commenting, and doing a lot of that follow-up. And so we went to weekly for quite a while, actually, right, Lourdes? I think it was probably for like 4 or 5 months, I want to say, before we went to then bi-weekly.
Wow.
And then we did bi-weekly all the way up until just the beginning of this summer.
Wow. So there was really people so responded to this, Julia.
Yeah, it was pretty significant. I think people were always consistently kind of interacting, asking for feedback, asking for commentary. And some people would get on Zoom if they felt comfortable, and other times people didn't, and that was totally fine. But the comments I would get either outside of the time of when we would have those charlas from like community members who had heard about it or who said like, this has been really great, please keep it up, to, people just generally commenting or finding my profile on like Psychology Today and just like just sending me messages about, how they found those charlas to be really helpful, were like just some of the, some of those specific outreaches that people had made, which, really held the importance of making those kinds of conversations steadfast.
And Julia, this word charlas, that's kind of like the word for chat. So you're sort of signifying from the get-go, this is super informal.
Exactly, right. And like, I think Lourdes and I and Gabriela too, like we really tried to keep it very casual. We'd like joke around and we'd talk about our own like kind of like feelings and personal stuff, really trying to like also make it feel like we weren't just, trying to keep this very, just about other people, that we were also being impacted in our own ways, and that made it real. I think it can be hard for people to feel like they can feel like other people are really understanding them if you don't at least, give a little. I mean, I think there's definitely some like, especially from a therapist standpoint, of course, like there is some boundaries you have to maintain, of course, but there is like a space that I think that is important in being able to like really truly connect with people. And so I think we really did a good space in being able to maintain that, and people really did like pick that up in a real way.
So this sounds like a wonderful group, and you guys have people coming for these chats. Then we get to the point where vaccines become available. Lourdes, is that something that you proactively began to talk to people about? Hey, this is coming. Like, here's how to get ready.
Yes. So the first thing that came up before the vaccines, we had mask mandate. as well. So we had to translate that, and we were also part of the a press conference with the county. And then the vaccines started coming. They were coming, so we had to start educating people in their language, meeting them where they were. That was very important. And so, unlike what many people thought, that the Latinos were not ready, they were absolutely ready, and they were waiting. They were waiting, and they wanted the access. We just didn't have it. So whenever we did get the opportunity, we were able to collaborate with other organizations. We were able to bring them out there right away.
So you didn't see hesitancy. It was more an access issue maybe than people not being sure they wanted it.
Access and language, the language barrier, that had a lot to do, because even when we were doing the vaccines, they would say, well, I'm going to wait until you do another one, because we share information all the time of vaccine events and stuff. But we get emails and they'll say, I'm just going to wait until you're going to be there. I'm like, but there's somebody there. That's hard, because they want to go and know that somebody is there, and they're not going to have that language gap.
I can see, it just feels like anytime you travel in a foreign country and you don't know the language, you just feel so uncomfortable even saying, excuse me. You just feel like I'm not going to know what they're saying in response. And Julia, I understand this even goes beyond that. It's not just about language. It's also about understanding the culture. Is that important? From a healthcare perspective?
Yeah, absolutely. I think, we talk about a lot in just in general in like healthcare provision and provision, I think, of just like social services, cultural competency. And that really is just kind of the bare minimum, I would say. Like being culturally competent is to have like just the bare minimum understanding of cultural understanding of a person and their background. But in reality, what we really want to be moving towards is cultural humility, which is a ever growing, ever moving needle of really truly understanding someone's, cultural background. May it be from, ethnic, racial, religious, standpoint, etc. I think that those kinds of that humility really means, one, understanding like your own bias and your own your own upbringing and how that influences your understanding of others. But then also two, that, there's always going to be an obscured understanding of history, and that you always have to be digging and understanding what it is that's happening and where you work and what you've done and the kind of work that you are doing, has sometimes hindered, the kind of impact that you are having on individuals in the community. And so both understanding that we are here to help, but that we have also caused, a lot of harm, at the same time. And so being able to walk that line and understand, where privilege is, and then also being able to really provide, a really solid understanding of like, okay, I understand where I am at, and I can only understand to a degree where another person is, because I can't, be an expert in everything, but I can most definitely always be actively learning and actively engaging in history and knowledge that I don't know enough about. And I can be very, real about not knowing that.
So this group has just done tremendous work. It sounds like you have such a good base here where you've reached this community, you've formed this group. Lourdes, in our final minute here, what do you see as next on the horizon for STL Juntos?
Well, we're still working on vaccines.
That's true. You're not at 100%.
We are not done yet. And we need funding. Thankfully, we just were honored to get a $10,000 grant to expand our vaccine outreach.
That's great.
Thanks to the St. Louis Mosaic Project. So we're super excited, and that's where we're going next. We're still continuing to, share resources and vaccine information and vaccine access, language access, fill that gap.
Well, we are so glad that you are doing this work, and it sounds like just some remarkable success. So, Lourdes Trevino Bailan, thank you so much for joining us.
Thank you. Thank you for having me.
Lourdes is a co-founder of STL Juntos, and we also want to say thank you to Julia Lopez. Julia is an instructor in medicine in the Division of Infectious Diseases at Washington University School of Medicine. Julia, thank you.
Thank you.
This episode was produced by Laura Hamden with audio engineering and podcast design by Aaron Dorr. Our executive producer is Alex Hoyer. St. Louis on the Air is a production of St. Louis Public Radio. Understanding starts here.
Do you find yourself regularly listening to episodes of St. Louis on the Air? Suggest us to a friend you think might enjoy our conversations. And leave us a review and rating on Apple Podcasts on the App Store. It's the simplest way to help people discover our show. Thanks.
St. Louis Public Radio is a member-supported service of the University of Missouri, St. Louis.
Support comes from the Missouri Forest Products Association, providing more than 41,000 jobs in the production of wood pallets, railroad ties, white oak barrels, hardwood floors, and more. Details at choosewood.com.